Hi students, myself Dr. K. Shivaya, Department of Pharmacology, Shantiram College of Pharmacy, Nandyal. So our next topic is cancer chemotherapy. So what is cancer? So cancer is a uncontrolled proliferation of cells and spread in the body with abnormal forms and spread in the body with abnormal forms of body own cells. So there is no control. So that's why it is uncontrolled. So you don't your body your body cannot control that cells for the proliferation. Fine. So what is neoplasma? It is a mass of tissue formed as a result of same cancer is neoplasm same. So sometimes they are asking some terms in the 2 marks questions. That's why I mentioned. So, a mass of tissue formed as a result of abnormal, excessive, uncoordinated, autonomous, and purposeless proliferation of cells. This one also one definition: abnormal, excessive, uncontrolled, autonomous, and purposeless proliferation of cells we can call as cancer. That one also one definition. So here, abnormal means when you compared with the normal cell, it is abnormal. Excessive means more than number. Uncoordinated, there is no coordination between the one cell and another cell. Autonomous means here the cells itself production of cells. They are not autonomous automatically and purposeless. So it is no purpose of the proliferation of cells. There is no purpose. Proliferation of cells means multiplication of cells. That is cancer. Next term is carcinoma. Carcinoma is a malignant means like tumor, neoplasma, what you discuss. Malignant neoplasma of epithelial cells is called carcinoma or cancer. So maximum 80 to 90% of cancer from this only. So maximum epithelial cells distributed in our body more spreaded. So the malignant neoplasma of epithelial cells we can call it as carcinoma or cancer simply. Sometimes they can call it cancer. So sarcoma is a malignant neoplasm from non-epithelial cells or connective tissue. So that's we can call it as a sarcoma. So like suppose if you take in bone or cartilage or fat, there it is a developed cancer. There it is developed uncontrolled proliferation of cells. We can call it as sarcoma. That is the difference between the carcinoma and sarcoma. Okay. So cancer chemotherapy not successful as an antimicrobial therapy. See here, the antimicrobial. So why it is not, see the cancer chemotherapy, why it is not successful? Because of the drugs act on the our cells, but antimicrobials act on the microorganisms. So that is a major difference. So metabolism in parasites different. Metabolism, their cells metabolism different, our cells metabolism is different. So the target is easy. For the targeting the microorganism easy. For targeting the our cells it is difficult because of normal cells also going to die. So because of that it is very, so that's why it is not that much successful when compared with the antimicrobial chemotherapy. So target selectivity is more difficult in cancer. Cancer there is no substantial immunoresponse. Here there is no immunoresponse, but in antimicrobial you have somewhat immunoresponse. So diagnostic is a complexity. Diagnosis is also very difficult in cancer. Which cancer it is? Where it is formed? Delay in institution of treatment for getting the, because delay. Some people getting the cancer, they don't know. They don't know we got the cancer. But when it is come, when you know, then it is maybe chronic condition, or when you maybe getting the pain, more pain. So then only already the cancer is developed. So that's why it's a diagnosis. It's a difficult. But if you take any disease as a microorganism disease, within 3 days or 4 days, we can get either we can get the fever, we can get some illness. It is easy. We can identify the is easy to identify the diagnosis for the microorganisms causing any infection or disease. But in cancer, it is a delay. It getting the delay, maybe 6 months or 7 months, so we can get the this person getting the cancer. So that is the major reason for why the cancer chemotherapy not successful. So modalities of treatment in cancer. So what are the possibilities? So you can get the cancer. Okay, what is the major the treatment is surgery and radiotherapy is the successful, but 1/3 of patients can be cured effectively when tumor has not metastasized. So when the cancer developed in our body, it is developed any one part, we can cure easily by the surgery and radiotherapy. But if it is spreaded to other organs, that is metastasis. First, it is developed in one organ, that is cancer. That is a primary tumor actually. That primary tumor then spread into the another organs, that is we can call as metastasis. Already you studied in pathophysiology. So that's why he's telling. So surgery and radiotherapy cure effectively. Effectively treatment is surgery and radiotherapy, but when it is possible or not metastasized, if the cancer is not metastasized, it is cured. Then chemotherapy is 50% of the patients can be treated with chemotherapy, contributing to cure 15 to 20% of the patients. Okay, any patients we can treat the chemotherapy. 50% of the patients we can get, but outcome only 15-20% patients are cured. Okay. So what are the possibilities of cancer can be curative? Curative. What is the possibility of a curative? So what we can cure? So acute leukemias, Wills tumor, Ewing's sarcoma, choriocarcinoma, Hodgkin disease, lymphoma sarcoma, and Burkitt's lymphoma, and testicular teratomas, and seminomas. These are the possibility of curative treatment. So if you given the treatment, we can cure in children's. Only palliative effect. So breast, little effect only little effect. If you given the treatment, these are the very these type of cancers, breast cancer, ovarian cancer, we can observe the adults. We can observe the adults. If you given the treatment, either radiotherapy or surgery or chemotherapy, but it is cured very little amount, means palliative effect, not that much, not a perfectly cured. And these are very less sensitive in chemotherapy. And if you treated chemotherapy, means what? The substance we can obtain from the microorganism or semi-synthetic, that we can treat to the disease. Here the disease is cancer. Here disease is cancer. So if you using the drugs in these cancers not respond properly, this is less sensitive. So these cancers not respond, very less sensitive, less effective. But in this only we can observe that surgery or radiotherapy. These are the two we can treat these type of cancers. It is adults only. Here I am differentiating the treatment. Okay, I understood my problem. Okay, these colorectal cancer is there. If you given the chemotherapy, you cannot cure. If it 3%, 4%, if it is only cure, but so that time you have to treat with either surgery or radiotherapy. So like that we can other cancers. So what is the pathogenesis of cancer? Already you studied in 2 I think I only explained for you how the development of a cancer, just to go through once the pathogenesis of cancer. Here I am briefly explaining. So the chemicals exposing, continuously exposing of chemicals because of some viruses, some radiation, other etc. Because of this, the mutation takes place in our cell. That mutations, when mutation takes place in the gene or DNA, that we can call as oncogene. That is, we can call here oncogenes. Okay. Some inherited mutations, they are inheritation from the parents. From the parents only they get mutation. If the DNA or gene mutated, we can call it as oncogene. We can call it as oncogene. So that oncogene promotes oncogene promotes proliferation of cells. Proliferation of cells. Here. So these oncogenes, the proliferation of cells. See, it is directly I am saying. But these oncogenes, what is happening? Expression of decrease the expression of tumor suppressing genes. Actually, in our body have the suppressor genes. Tumor suppressor genes is the P53 and RB, etc. These actually what happened in our body, these genes to suppress these genes. Oncogenes can form next is development of tumor, that is confirmed. But our body immediately to expression of these P53 and RB to inhibit these oncogenes, so there is no formation of a primary tumor. But what is happening here? The expression of these tumor suppressing genes are inhibited. If it is inhibited, the oncogenes have to develop their multiplication of more cells. So promotes the co-carcinogens and hormones. So that is leads to uncontrolled cell proliferation differentiation. If these tumor suppression genes activated properly, if they're doing the function very well, the apoptosis programmed cell death. Apoptosis is a programmed cell death. That cells are killed, they are eliminated from the body. If the tumor suppressor genes activated properly or functioned properly, we can get the apoptosis. We can get the apoptosis programmed cell death, alteration telomerase engine. Because of this, so actually these no formation. ట్యూమర్ సప్రెసర్ జీన్స్ కింద కరెక్ట్గా యాక్టివేట్గా అయ్యి కరెక్ట్గా ఫంక్షన్ అయినట్లయితే మనకి ఏం ఫామ్ అవుతుంది? అపోప్టోసిస్ ఫామ్ అవుతుంది, లేదా టెలోమెరేజ్ అనేది ఫామ్ అయ్యే అల్టరేషన్ జరిగి సెల్ డివిజన్ అనేది జరగదు. కానీ ఈ ట్యూమర్ ఎక్స్ప్రెషన్ అనేది జరగకపోవడం వలన ఈ ట్యూమర్ సప్రెసర్ జీన్ అనేది ఇన్హిబిటెడ్ అవ్వడం వలన అపోప్టోసిస్ అనేది డిక్రీజ్ అవుతుంది. బికాస్ ఆఫ్ దిస్ development of a primary tumor. So these oncogenes promotes the co-carcinogens and hormones. That hormones more proliferation of cells, uncontrolled proliferation and differentiation. So that is the development of primary tumor. So once I am repeating. So the chemicals, virus and irradiation or radiation, other carcinogens to produces the mutation in the cell. So the mutation of gene we can call as oncogenes. The oncogenes promotes the co-carcinogen. These carcinogens to produces the uncontrollation of cells and proliferation of and differentiation. If it is, and also one more is inhibition of, if the tumor suppressor gene, if it is inhibited, tumor suppression is, if it is inhibited, there is no apoptosis or decreases the apoptosis development of a primary tumor. After development of a primary tumor, production of metalloproteinase. So the primary tumor to produce the metalloproteinase enzyme. Because of that enzyme, that enzymes to break the organ normal cells and to lysis the protein of the organ. Proteinases to lysis the our protein. Then invasion of nearby tissue by tumor cells. So the tumor cells, this is our body organ. So the tumor growths are developed. So they release the metalloproteinase enzymes. These enzymes to lysis this entire protein, it is opened. Then invasion nearby, whatever the organ it is, that it will enter by tumor cells. Then after that, these tumor develops the new blood vessels. The tumor develops the new blood vessels, that is we can call as angiogenesis. Angiogenesis definition is development of new blood vessels in that tumor, we can call as angiogenesis. So after this development, development of new blood vessels, it is formed. ఎప్పుడైతే ట్యూమర్ ఫామ్ అయింది, ఎప్పుడైతే మనకు ఆర్గాన్లోకి వచ్చిందో న్యూ బ్లడ్ వెజల్స్ ఫామ్ అవుతాయి. న్యూ బ్లడ్ వెజల్స్ ఫామ్ అయిన తర్వాత యాంజియోజెనిసిస్ అన్నాము. ఈ యొక్క ట్యూమర్ ఏమవుతుందంటే ఫైనల్గా ఈ డివైడ్ అయ్యి ఆ బ్లడ్ వెజల్స్ లోపలికి వెళ్ళిపోయి, దెన్ ద బ్లడ్ it is enter into the blood. Because of the blood vessels form, then again the tumor cells enter into the blood. Then again that tumor cells reach to the another organ. The tumor cells, the primary tumor cells reach to the another organ. There it is developed secondary tumors. That is we can call as the passage of primary tumor cells to one place to, or one organ to another organ, we can call as a metastasis. Metastasis means the primary tumor cells pass from the primary organ to another organ. There it is, that passage we can call as metastasis. There another organ to develop the secondary tumor, we can call as a metastasis. So like that secondary tumor cell. Then again their secondary tumor cell, again it will be third, fourth, 5, 6, like that. It is more tumors formation in the entire organ system. So that is the pathogenesis of cancer. This is one more. So for understanding purpose only, that flow chart I given. So this is a normal cell. DNA damage takes place. If your cell activated properly, the DNA repair takes place, it will get to the normal. The successful DNA repair, if it takes place, it gets to normal. If it is failure of DNA repair, mutation in the genome of somatic cells. Somatic cells, cell and better you remember cell. So mutation when it takes place, activation of growth promoting oncogene. Activation of mutation when ఎప్పుడైతే mutation అయిందో activation of growth promoting oncogene, nothing but oncogene that is formed, expression of altered gene products, loss of regulatory gene products, and malignant neoplasma. Okay, so if the is another alteration of genes that regulates apoptosis. అంటే అపోప్టోసిస్ ని రెగ్యులేట్ చేసే జీన్స్ ఉన్నాయి. అవి గిన ఫంక్షన్ గిన్ జరుపుకోకుంటే, ఇందాక చెప్పాను ఫంక్షన్ జరుపుకోకుంటే, అగైన్ దిస్ ఇస్ రెగ్యులేటరీ జీన్ ప్రోడక్ట్, ఆల్టర్డ్ జీన్ ప్రోడక్ట్స్. ఇన్యాక్టివేషన్ ఆఫ్ క్యాన్సర్ సప్రెసింగ్ జీన్స్, అంటే క్యాన్సర్ సప్రెస్ చేసే జీన్స్ ఏమైనా P53 ఉన్నాయి కదా, సో ఆ జీన్స్ గిన ఇన్యాక్టివేషన్ అయినట్లయితే then expression of altered gene products. Altered gene means nothing but mutation. So finally you can get the malignant neoplasma. So before going to the classification of anti-cancer drugs, you have to know the cell division, how it is takes place. That is phases of cell cycle. If you observe, G0 phase is a resting phase between the G1 and metastasis phase. Already we discussed in the pathophysiology the entire cell cycle and checking parameters also. Already we discussed, just to go through it once. See, these G0 phase is a resting state, cell is not dividing, is just rest. Then after that start the G1 phase. Here the synthesis of enzymes needing for the DNA synthesis. Here only enzyme synthesis takes place for the replication of DNA. So here in the synthesis, DNA is replicated. In G2 phase, synthesis of cellular components required for mitosis. Cell division, for further is cell division. So whatever the required for the cell, the entire components are prepared in the G2. In M phase, we can get the cell division. So cell will be divides. So this is the phases of a cell. Cancer cells differ from normal cells. Cancer cells differ from normal cells. What is that? Uncontrolled proliferation, differentiation, de-differentiation. The differentiation is so there is no that much difference. A differentiation is maximum is when compared with the normal cell. This differentiation is, and the loss of function. Loss of function, invasiveness. Here the cancer cells have the invasiveness, but normal cells don't have that capability because of the cancer cells produces the metastatoproteases, produces the cancer cells produces the proteases enzymes. The tumor cells produces the proteases enzymes. That's why they have the capability of invasiveness. And the cancer cells have the metastasis, but normal cells don't have the metastasis. So what is the, how we can treat the, what is the principles of cancer chemotherapy? So to achieve to cure the total cell kill must be tried. Early diagnosis and early institution of treatment. Early diagnosis చేసుకోవాలి, early treatment చేయాలి. That is the main principle. And a combination of chemotherapy, we have to use the combination. And intermittent regimen. If any treatment, if it is not worked properly, we can change the another treatment. Adjuvant and neo-adjuvant chemotherapy. Any new chemotherapy it is available, we have to use properly, but it is occasional. So early diagnosis and early, what is so early diagnosis చేయడం వలన మనం క్యాన్సర్ ని స్ప్రెడింగ్ అనేది తగ్గించవచ్చు, మెటాస్టాసిస్ అనేది తగ్గించవచ్చు. సో because of this aging cells are less susceptible to chemotherapy because there is a cell cycle time, number of actively dividing cells with more resting cells, so increase the cell death with the tumor. So overcrowding of cells, so we can reduce the overcrowding of cells. Earlier diagnosis చేయడం వలన this is the possibility. So what are the general toxicity of cytotoxic drugs? So next we can discuss about the drugs. So these are the cytotoxic drugs. Maximum alkylating agents have the cytotoxic drugs. So nausea, vomiting, bone marrow depression, alopecia means loss of hair, gonads, we can get these impotence and decreases the ovulation, fetus abortion, fetal death, teratogenicity possible, carcinogenicity. The cytotoxic drugs causes the cancer. If you use over, see, so hyperuricemia, you can get the high uric acid levels in the urine, and immunosuppression and hazards to staff. And so who is preparing these, nothing but those are manufacturing that they are also getting the hazards. So this is a classification of anti-cancer drugs. So first is cells cycle non-specific. So they kill the resting cells and dividing cells, but these are only killing the dividing cells only. So ఇవి రెస్టింగ్ సెల్స్ లో ఉన్నా కూడా ఈ సెల్స్ ఇవి డ్రగ్స్ వచ్చేసి కిల్ చేస్తాయి. సో జస్ట్ యూ సింప్లీ కీప్ ది దీస్ ఆర్ ది సైటోటాక్సిక్ డ్రగ్స్. సైక్లోపాస్ఫోమైడ్, క్లోరంబూసిస్, సిస్ప్లాటిన్, యాక్టినోమైసిన్ డి, ఎలాస్పెరిజినేజ్. నెక్స్ట్ సెల్ సైకిల్ స్పెసిఫిక్ వచ్చేసి G1 phase. G1 phase లో we can observe the vinblastine, vincristine. S phase methotrexate and 6-mercaptopurine synthesis phase. They inhibit the synthesis phase. These drug inhibit the G2 phase. These drug inhibit the M phase. So here the G1 phase only vinblastine, and here also vinblastine involved in the metatic phase also. Depending on mechanism at cell level. Depending on mechanism at a cell level. So that is one classification. This is one classification. So this is a direct acting cytotoxic drugs. So direct cytotoxic effect. They kill the cell directly. So alkylating agents, antimetabolites, natural products, antibiotics, vinca alkaloids, taxanes, epipodoxy, phytotoxins, camptothecin analogs, enzymes, biological response modifiers, and mislasins. Indirect acting by altering the hormonal, corticosteroids, estrogens, and 5-alpha reductase inhibitors, gonadotropin releasing agonists, and progestins. So first, if you take into the nitrogen mustards, coming to the alkylating agents, in that nitrogen mustards, meclorithamine, melphalan, chlorambucil, cyclophosphamide, ifosfamide, ethylamines, thiotepa, alkyl sulfonate, busulfan, nitrogen ureas, carmustine, lomustine, streptozocin, triazines, decarbazine, and temozolomide. These are all alkylating agents, are cytotoxic drugs. These cytotoxic drugs are whatever is the adverse effects is, these are all adverse effects. These are all the adverse effects of cytotoxic. Actually, that's mundu ravalsindi. Okay. Next, antimetabolites. So what is the antimetabolic drugs? Is a folate antagonist. Folate reductase already we use, sulfonamides we discussed. So the same mechanism action. Methotrexate, purine antagonist, 6-mercaptopurine, 6-thioguanine, azathioprine, pyrimidine antagonist, 5-fluorouracil, cytarabine, and gemcitabine. Natural products. So these are the natural products. Antibiotics, these are all vinca alkaloids, taxanes, these enzymes, these drugs, and other drugs. These are the miscellaneous. These are the hormones and an antagonist. Okay. So here the overall mechanism of action of anti-cancer drugs. See, these purine and pyrimidine antagonist, to inhibit the purine and pyrimidine synthesis. To inhibit the purine and pyrimidine synthesis. So you know what is the role of the purine pyrimidine, the very essential for the DNA base peptides. Next, 5-fluorouracil inhibits the 5-fluorouracil inhibits the formation of ribonucleotides. Here the formation of so inhibit the formation of deoxyribonucleic DNA. Methotrexate also to inhibit the in metabolites, required metabolites. This is 5-fluorouracil and methotrexate inhibit the metabolites for the requirement of DNA. And cytarabine inhibits the DNA chain elongation. And dactinomycin inhibit the DNA to means the transcription. Okay, alkylating agents directed to inhibit the here DNA to RNA transcription, alter the structure and function of DNA by cross linkage and fragmentation of DNA. So these are the possibilities of all anti-cancer. So only few are mentioned here. Again, we can discuss each and every drug mechanism of action. So you know alkylating agents, nitrogen mustards. So already we discussed drugs. Come to the mechanism of action. So these alkylating agents form highly reactive carbonium ion. So the alkylating agents, when you taken, then it forms the carbonium ion after reaching into the system, your system. That carbonium ion transfer alkyl group to nucleophilic sites and DNA bases. As a result, DNA bases के direct का bind होता है. So because as a result, these result cross linkage, abnormal base pairs formation, DNA strand breakage. So these three formed. So this decreases the cell proliferation. So these alkalis also damage the RNA and proteins. So these carbonium ion bind to the RNA as well as proteins. So this is one of drug. This is alkylating, one of alkylating agents. Sorry, this is miclorethamine is one of agent. This is a DNA. Okay, this is a DNA base pairs. So when it is formed carbonium ion, when it forms the carbon, you see here the bind with the nucleic base. So cross linked strands. This is a DNA base. Okay. So guanine bases. So cytosine and guanine adjacent bases it will form. So these miclorethamine is one of alkylating agents. It binded. So when it is binded, the DNA base pairs is not formed. When the DNA base pairs is not formed, the DNA not formed. So this is the main mechanism of action of the alkylating agents. So miclorethamine, when it lost the Cl minus, when it is reached to our body, it forms the ions, and these ions easily bind to the DNA base pairs. Then pharmacological actions, cytotoxic action. Some of these cancer drugs, especially alkylating agents, the main mechanism of action is directly to kill the cell. If the overdoses, it affect our cells, normal cells. See, what is the meaning of pharmacological action? You know, the drug act on the systems or organs. We can call it as pharmacology. Here we given the drug. This drug mainly act on the cancer cells, but apart from that, it act on the our cells. So that's why it is called as pharmacological action. So cytotoxic action. So on the normal cells it produces the toxic. So that's why they give it. So same, whatever the adverse effects I take given cytotoxic, all adverse effects we can write. Next, immunosuppressant action. See, they inhibit the immune system activation because of they kill the direct cell, direct protein. All antibodies are made up of protein, so inhibit the immune system. And miscellaneous is nausea, vomiting, and radio mimetic drugs. So these are all drugs to act as a mimetic, as a radio like radiation, so to inhibit the cells. So other drugs, mechanism of action also similar. Meflona, chlorambucil, cyclophosphamide, liposome, all drugs, these all alkylating agents are same mechanism of action, same adverse effects. So this is the okay. So whatever you discussed about this session, cancer and terms of some sarcoma, carcinoma, neoplasma, and pathophysiology of cancer, and classification, and one drug mechanism of action and adverse effects. So these are the questions. Define cancer, define terms carcinoma and sarcoma, write pathophysiology of cancer as a flowchart, classification of anti-cancer drugs, mechanism of action of alkylating agents as a flowchart, write it. And here classification of anti-cancer drugs, second classification I given. This is the second classification. In that second classification, again sub classification is there. You have to write the entire. This is very important. Anti-cancer drug, cancer chemotherapy question lekunda question paper ఉండకపోవచ్చు నాకు తెలిసి. సో క్యాన్సర్ కీమోథెరపీ అనేది కంపల్సరీ, గన్ షాట్ క్వశ్చన్ కంపల్సరీగా వస్తుంది. ఎస్పెషల్లీ క్లాసిఫికేషన్ వెరీ ఇంపార్టెంట్. సెకండ్ క్లాసిఫికేషన్ నేర్చుకోండి. తర్వాత దీని కింద మళ్ళీ ఆల్కలైటింగ్ ఏజెంట్స్, అగైన్ క్లాసిఫికేషన్ అయితే దీస్ ఆర్ ది ఆల్కలైటింగ్ ఏజెంట్స్, దీస్ ఆర్ ది యాంటీమెటబోలైట్స్, దీస్ ఆర్ ది యాంటీబయోటిక్స్, వింకా అండ్ అదర్ డ్రగ్స్ classification is there. This entire you have to write up to miscellaneous. This is the entire classification. Thank you one and all. All of you watch video properly. If you have any doubts, comment on the video. After watching the video in YouTube, please comment it if you have any doubts. Thank you.